Best Way to End Temper Tantrums by Katrina Lujan. What is a temper tantrum? A tantrum is a negative and troublesome behavior mainly attributed to toddlers. This is my daughter Halo. Cute, right? She has temper tantrums, however, they used to be a whole lot worse. She is the most affectionate, loving baby I know, but she has a temper. She even had a holding breath spell, kind of like a seizure, for having a severe temper tantrum. I knew there had to be a reason or a solution for temper tantrums, so I did my research. Now, I just want to share my findings with every parent struggling with this. I hope this helps. Why do temper tantrums happen? Young children want to declare freedom by denying authority. Psychology states that these occur when our form of self is developing. Speech delays, frustration, and manipulation. Temper tantrums could look like any of the following. Their rage may include behaviors such as screaming, cursing, breaking things, rolling on the floor, kicking their feet, crying loudly, holding their breath, banging their head, throwing objects, biting self and others, flailing arms, hitting and running around the room. Castellino. There was a study in 2019 associating toddler tantrums to having less expressive language. This study examined the frequent clinical observation that toddlers with less expressive language have more severe temper tantrums. Manning. Language delays. Like temper tantrums, language development falls along a continuum of typical to concerning. Most toddlers achieve first spoken words by 12 months and acquire 50 spoken words and two-word utterances by 18. Children not having expressive language led to tantrums and more severe ones. If a child is delayed in achieving these expressive vocabulary and word combination milestones, he or she is considered to have a language delay, often called late talking in toddlerhood. Study results. These results are consistent with previous studies in older children which have shown that lower expressive language ability is associated with internalizing and externalizing problems. This work also expands our group's previous work in the same sample, which showed an association between broader language ability and irritability in toddlers 18 through 36 months. Parents, rest assured, this is not your fault. Many young children have tantrums, whether it's for frustration or manipulation, and they are completely normal. They are a part of life as your child learns and grows. You are not alone. What's the best way to end tantrums? Preventing them. Best ways to prevent tantrums. Identify triggers, remaining calm, adequate amount of sleep, well fed and nourished. Talk your child through activities, distracting your child away from what he or she wants, good behavior rewards, affection and comfort, offer choices, lead by example, alternate activities, let child be a child, acknowledge them, celebrate them for controlling their frustrations. Sometimes tantrums cannot be prevented. Toddlers are unpredictable, and it's okay. Tips for parents during tantrums. Breathe. Remain in sight. Send child to cool off. Prevent injury. Stay consistent with your demands. Do not plead with your child. Use manners when speaking. Stay calm even if they say no. And don't discipline if they do not agree. Whether you are preventing or trying to get through a tantrum, the number one thing to do is remain calm. After tantrums, a study was conducted in 1997 to better understand young children and their bond with their parents. Young Children's Post-Tantrum Affiliation, PTA, with their parents. In our database of 331 parental narratives of tantrums had by children 18 through 60 months old, 29% of tantrums were followed by child-initiated affiliation with parents. The study results. This chart represents the amount of children initiating an apology after a tantrum. The biggest finding. The finding that PTA increases with tantrum intensity is perhaps the most obvious result. The more severe the tantrum is, the more bonding the child wants and needs. This study proves your child is empathetic. They want love and acceptance like everyone else. Many children realize their behavior was negative and they are apologetic. They need reassurance and comfort to know they are loved. As hard as it is, stand your ground. Don't ever give in to your toddler's demands. This leads to long-lasting manipulation tantrums. Young children usually grow out of this if parents have stern expectations. If tantrums worsen and your child starts to harm themselves, seek help. The best way to help your child is to educate yourself on their differences, call your pediatrician, and they can give you tips or refer you to some better help. My personal findings. From my own experience, I learned Halo doesn't speak yet, and she's already 20 months. She was being frustrated because she could not express her wants. Her tantrums were not for manipulation. Her tantrums included crying, throwing herself back, and throwing items. I realized a good routine prevented tantrums 90% of the time. Feeding, baths, naps, play, and adequate sleep. If they did happen, what worked best is talking her through activities. Most importantly, for both of us, is for me to remain calm. You are not alone, and this too shall pass. Best of luck and happy parenting.